Hello, hi guys. Okay, now we're coming to this topic today on management of near drowning patient. What do we do? How are we going to treat these near drowning victims that we have? Okay, I'm going to share with you today about that, and this is very exciting. Okay, now I think we can divide our management of these patients at the pool sites and also at the emergency department. But I know you guys, you are basically at the pre-hospital or at the scene. So basically, that's where I'm going to concentrate on. What do you do if you found someone who have near drowning? Okay, now, well, as I mentioned earlier, if you see someone in the water and he's having problem having water injuries, the best thing to do is get him out of the water. All right. Now, however, there are situations where you can get him out easily, but there are also situations when you have to basically be very careful if you want to bring them out, especially if this is a victim of diving injuries, where you suspect there might be some injuries to the spine, especially to the cervical spine. So whatever it is, my advice to you, the first thing you need to do, please approach the victim carefully. Do not do not cause a lot of waves as you go when you swim to the victim. Swim as quiet as possible to the victim. Now once you arrive uh, to the side of this victim, as far as possible, follow the principles. Do not touch them, but basically call them. Right, call them as you near them. If they're conscious, that's good. Basically, you can see whether they are breathing or not. All right. Now, if the victim is breathing, you stop about 1 or 2 meters from them, and you can pass them the buoyancy floating device, and they will grab on that thing. The problem is that if you come close to them, you call them, there is no response. So you have to go quite near to them, and the first thing what you do is actually try to call them. All right. Now, if there is no response, the next thing you need to do is you need to assess whether the victim is breathing or not. If the victim is not breathing, then you need to provide this thing called expired air resuscitation. Now, what is this? Is basically giving rescue breathing through the nose. While the victim is in the water. Okay, as you swim and bring them to the land. Okay, this is all will be showed to you in the video, and also when you come to the part 2 or the practical part of the course, there will be a real demonstration on how EAR is being done. Okay, now if the victim is breathing, then by all means, very easy, pass him the flotation device or the buoyancy aids or whatever you carry during your swimming, during your swim to the victims, and basically tug him or bring him to the land. Now, however, if you suspect there's a spinal injury, then what you need to do, you need to perform spinal protection. Okay, again, there are a few ways how you can do it. Okay, you can do what we call as vice grip. Vice grip will be shown in the video, and I'm sure you have already by now, you have already seen the video of how to perform a vice grip. And then you put him on the C collar or cervical collar, and then mount him on the spinal board while you basically tug him or basically bring him to the land, to the shore. Now, once you reach the shore or you reach the edge of the pool, or depends on where you are, basically you need to carefully remove the victim, okay, from the water. Okay, you must remember, especially if someone has spine injuries, especially cervical injuries, you need to really be careful. Use the technique that you have learned. Okay. Now, once he's out of the water, what you can do, you have to assess his level of consciousness, and basically whether he's still breathing. Right? He might be breathing in the water, but by the time he reaches to the shore, he's not breathing. So you have to assess that. Okay? So if the patient is not breathing, you have to immediately start CPR. Okay? Remember the 4A, the third A, which is the 8. You know the diagram, the 2 by 2 diagram that we showed to you. Okay? So basically, if the patient has not breathing, basically you can assume that basically there will be no pulse. So you have to start your CPR once the patient is on the shore. All right? And again, look for any bleeding, this thing. Right? Get someone to call the EMS or the paramedic to come and help you.